Hello everyone, and welcome. Today, we're going to explore scenario MCQ for nurses, quick answer. This is actually the first slide, so I just want to start by saying how excited I am to be here with you all. Our focus today is on scenario-based multiple-choice questions for Qatar Prometric. We'll be looking at how to approach these questions effectively and efficiently. In this presentation, you'll get some practical tips and strategies to prepare for your exam. So, let's get started and make the most of this session. Let's focus on the priority nursing action when a patient has a silent chest during an asthma emergency. A silent chest is a critical sign that the patient is experiencing severe airway obstruction and is not producing breath sounds. This indicates that ventilation is severely compromised and immediate action is necessary. In such cases, our main goal is to ensure the patient gets urgent intervention to restore airflow. This often involves administering rapid-acting bronchodilators, providing supplemental oxygen, and preparing for possible advanced airway management. Recognizing a silent chest quickly is essential because it signifies that the situation is life-threatening. It's important to stay calm, act swiftly, and follow established protocols to improve the patient's chances of recovery. Remember, early recognition and prompt intervention are key in managing this emergency effectively. All right, let's talk about a critical situation involving a patient with acute asthma who suddenly develops a silent chest. Now, a silent chest is a very concerning sign because it indicates that airflow has become severely compromised, and the patient might be at risk of respiratory failure. When we see this, our first priority must be to act quickly. So the question here is, what should we do first? Option A suggests giving a nebulizer, which is a common treatment, but in this case, it's not the immediate priority. Option B recommends increasing fluids, which can be helpful in some situations, but again, it's not the most urgent action here. Option C tells us to notify the doctor immediately. This is crucial because a silent chest is a medical emergency. Prompt medical intervention is required to prevent deterioration. And finally, option D suggests assessing blood pressure, which is important for overall patient assessment. But in this scenario, the priority is to alert the healthcare provider right away. So, the most important concept here is recognizing the seriousness of a silent chest in an asthma patient and knowing that contacting the doctor immediately is the key step. It ensures that the patient gets rapid assessment and potentially life-saving interventions. Remember, in emergencies like this, quick and decisive action can make all the difference. Now, let's discuss what to do if you encounter a silent chest during an emergency. Remember, a silent chest means there is no air movement, which indicates a severe airway obstruction. This is a life-threatening situation that requires immediate action. The most important step here is to notify a doctor or call emergency services right away. Prompt medical intervention is crucial to prevent further deterioration and to save the person's life. So, always recognize the signs quickly and act decisively. Timing can make all the difference in these critical moments.